Facial rejuvenation really is a continuous process. There is the surgical procedure itself, but then there's all the things that we do afterwards that help you to maintain an optimum result. So what can you as a patient do? Well, number one, avoidance of the sun is very important. Number two, minimizing stress, because that has terrible wear and tear on everything from our hearts to our brains, etc. Exercise, the more people study longevity, especially healthy longevity, this is really the linchpin. And keeping weight in balance. Obviously, great cycles up and down in weight are going to affect the results of a facelift. So what are the things that we can do to help you? Well, our patients are very active people. They love to be outdoors, they play tennis, etc. Medical grade sun protection is really one of the best and most important things because it's formulated in a way to be effective, but also it avoids that greasiness that some of the earlier compounds had, which, you know, people aren't going to put them on because they hate the way it feels on their skin. There's been big advances there. Also, good medical grade skincare products are super important. Vitamin A derivatives, I think almost everybody should be on those. They're phenomenal. But there's a whole range, some of which have some bioactive compounds, etc. And having expert guidance in that regard can be tremendously helpful. In terms of maintaining the tone, very often patients will come to us and we'll do different techniques. Forma, which is a radio frequency technique that gently heats the skin, will give it a little bit of extra tone. Another one called Morpheus, which uses a different type of radio frequency. This can be great. And of course, texture of the skin and pigment character. These are things where we'll often use broadband light, which is rejuvenating in itself, but also evens out pigment, and the hybrid fractional laser, the halo device, which we absolutely love because that helps with surface texture. Over the longer term, there's things that we can do too. Use of Botox is very helpful because it gets away from those expressive patterns that may have caused some of the ill effects in terms of the facial structures. We love doing fat transfer as part of our facelift surgery, and many a time, patient will come back a few years later and we'll do just a little booster. And of course, sometimes they'll come in for fillers as well. And then further down the road, eventually, I always tell my patients I can turn the hands of the clock back, but they're going to go forward again. So there's a whole raft of different secondary procedures that we can do for patients who want to maintain that really great result.